The main symptoms that have been described with COVID-19 are fever, cough, and shortness of breath. Interestingly, unlike many other respiratory viruses, only a minority of patients have been reporting upper respiratory symptoms like runny nose or sore throat, although some people have reported those. Coronaviruses, including COVID-19, can create a spectrum of illness. And so some people will be very mildly affected, and some people can have more severe disease. So the severity of illness can range from having a cold or flu type illness all the way to needing to be hospitalized or be in an intensive care unit. Based on what we know about this outbreak so far, as well as information about how other respiratory viruses are transmitted, the primary route of transmission for this is thought to be respiratory droplets. Respiratory droplets are usually transmitted when someone coughs or sneezes and someone else either inhales it or touches something that a virus particle lands on and then touches their own eyes, nose, or mouth. Generally, from coughing and sneezing with a respiratory droplet, those can transmit about 3 to 6 feet from the person who has coughed or sneezed. The best thing you can do to protect yourself and your family from getting infected, number one, is to wash your hands. The second thing is, if you do have symptoms, to practice what we call respiratory etiquette. That means coughing or sneezing into your elbow or into a tissue and then washing your hands well afterwards. We know viral particles that end up on your fingers and hands can be transmitted to other people, and so that's one way to protect yourself and your family. The other main thing that we would encourage people is to stay home if you're feeling ill with cough and fever especially.